The final panel today is dealing with women and responsible gaming. And I'm happy to welcome the moderator to the panel, Mrs. Christina Golna. She's head of policy change and management consulting with Innowth Limited. We have two speakers as well.
Thank you, Chair. Thank you. Thank you, ladies and gentlemen. Thank you for your patience. I know it's just us and lunch, so we'll try to be as brief and as substantial as we can. Let me just introduce my panel, Diane Thorogood. She is the Senior Project Manager of the Women and Gambling Program in Gamcare in the UK, and our own Miss Eva Symeonidou from the National Cyprus Addictions Authority. She works for the policy department there. It is my pleasure to moderate this session, which is one of the most critical policy challenges we are beginning to face within the gambling industry. It is very well understood now, and recent research confirms that women participation rates in gambling are almost similar to those of men. And it is with alarm that we find that almost 1 million women in the UK are currently affected by gambling-related harm or exposed to gambling-related harm. This has more than doubled over the past 5 years. And what is even more disturbing is that almost 1/3 of them, or even more, would be reluctant to seek help because of stigma. Now, you've already heard from the chairwoman earlier this morning that in an effort to bridge this gap between what may be considered a man's world and the actual reality of women needing help, the National Betting Authority, the National Cyprus Addictions Authority, and SPAVO, which is the Association for Preventing Domestic Violence, are working in the first comprehensive in terms of public health gender-specific program to empower and support women to seek help, identify the challenges first, seek help and support to manage their gambling or problem gambling behavior. And we need to stress that it is a program that integrates care and brings the pathway from screening to early detection, to linkage to care, to retention in care and recovery to women across Cyprus. But more on that in a minute. Let me first start with Diane here. Diana, I'm very keen to hear more and extremely happy to have you here with us on your women's program and how, and I will quote, it steers systemic change across policy, research, and treatment. So how does your program support women across the continuum of public health? So from screening, linking to care, keeping them in care, keeping them coming back for treatment through to recovery. What are the barriers that you have faced when launching the program and growing the program? And what can we learn from you?
So thank you for having me, first and foremost. I've been at Gamcare for approximately a year, and the women's program has been in existence. It's now in its 5th year. And what we see across the board is that women find it difficult to access support in terms of their gambling harms, whether it be direct gamblers themselves or affected others, mainly because of the stigma that is faced within society and within their communities, but also because I think a lot of women don't actually recognise the support that there is out there for them to receive. And so how we approach that is in several ways. So the first way is that we're an informed-based, research-based program. So all of the work we do is based on the research that is commissioned. We are commissioned by Gamble Aware to deliver the program, and they commissioned research which was just put out this year, and it was around building knowledge around the experience of women in gambling. And we fed into that research in 2 ways. One, with the direct experience of women and their gambling experiences, and also through our lived experience community. We have a large lived experience community that feed into the work that we do, both in terms of developing training, but also in terms of helping us to understand the best way to support them.
Exactly.
And so Also, coming back to your question, talking about barriers, I think one of the most difficult barriers for women is the responsibilities that they hold, just as mothers, just as carers, just being in the workforce, and the demands upon their time. And so one of the ways we sort of approach this as well is to support, it's internally and externally. So internally as an organisation, we train our staff, our practitioners, how to support women specifically. So if I give you an example, I spoke to one of the practitioners last week, and she was working with a client who seemed to be disengaging. And normally I think there's a number of sessions. If you miss a number of sessions, then
you're considered.
Exactly. But after speaking to the engagement leads on the women's programme, and specifically around, well, what is happening for that client? Why she's not attending her appointments. And then after reaching out to her, it turned out that she just wasn't able to engage because of the demands upon her time between work, between family commitments. And so they were able to arrange that she would do sessions in her lunch break, for example. Also, in terms of support, we've managed now to deliver support in every way. So there's face-to-face, there's virtual, there's ways that you can support yourself. We have a chat room for gamblers, women gamblers, where they can get peer support, and it's facilitated by practitioners. So we also have a support group for affected others, and again it's a 7-week program, and it's based upon sort of well-being and care, so helping the woman to build her health literacy around what she's experiencing, as well as receive support at the same time.
So I understand availability of solutions is critical. So
Yeah.
the more solutions we put out, the more we invite them to come in, visit, and use them. So if I may jump to Eva for a moment. So would you like to set some light into what sort of availability we have of such solutions in Cyprus, and what is the profile of women seeking care, and how can we address those barriers that Diana mentioned?
Okay. Unfortunately, we don't have so many support systems for women in Cyprus. At the moment, we have 6 licensed treatment services. They are not specifically directed to women. They are accredited by the Cyprus National Addictions Authority, and they provide treatment to women individually, mainly, because the numbers are too low. Let me say that from our data, over the period of 2018 to 2022, we recorded 368 demands for treatment. And from this number, only 16 were women.
Wow.
So we have only 16 women in treatment yet. This means that it doesn't mean that this is the problem, that only 16 women are in need. We are worried that they may not have the access to treatment. And I agree with Diana about the barriers she said before, about the stigma. We know that Cyprus society is a very closed society. A woman has to face with so many difficult roles, to be a mother, to be a professional, to be perfect in everything in general. It's very, very hard for her to ask for help. And here I would like to mention somebody called me 1 month ago. She wanted a referral for treatment. She told me, I want to go somewhere to treat myself. I have a gambling issue, but I don't want anybody else to see me going there. And I want to be alone. I don't want a group. I don't want males in the group. And I said, we don't have this kind of treatment. And Diana said before also about the chat rooms and about the online treatment, and I think this is a very good challenge for us, and we should consider us. But at the same time, I want to emphasize that we have programs in Cyprus, and they work very, very good. We have family support, we have individual care, we have social support, so it doesn't mean that we don't have access or you don't have treatment for gambling addiction issues.
No, definitely. And I think we're probably a few steps behind, but that doesn't mean that we are not on the right track. And I think the new program that we are launching for women and gambling and bridging the gap will specifically provide us with a pathway on how to screen, identify early, link to care, keep them in care, exactly as Diana said. We need to make sure that there is some flexibility and we can accommodate growing needs or changing needs so that women don't feel alone and they don't feel they need to leave their care for whatever reason. Apart from that, I would like to ask Diana, I've read the impressive number of 8,000 professionals being trained, and I'm wondering, how did you do it? And also, what is the reaction of other stakeholders in the wider area of managing, an addiction, be it, the gambling providers or be it the healthcare system? This is also critical for us here in Cyprus as we are seeking to integrate our care within the national health system.
Well, I think the one thing that's common across the whole of Europe and the UK is that gambling is still very much a hidden harm. So for a lot of the professionals that we work with, how we engage with them is around the screening. So most assessments for any professional that's working with women do not include screening questions around gambling, whether it be direct gambling or whether it be the gambling of another that's as part of your circle. And so I think a lot of the stakeholders and a lot of the professionals that we come into contact with, they've never really thought about gambling, asking that screening question. So that's where we start. And so in our learning outcomes, is we focus on the screening question. We start with the screening question and we end with the screening question. And what we say to those professionals is, what will you now do differently? And how can we support you to do that?
So I think that is also part of your training as well in the women's program. So you focused very strongly on the small and the long and the short and the long questionnaire to screen women. So I think that would be also critical for the Cypriot program.
Yes,
Eva?
it is. Let me tell before you asked me before I didn't answer this question about the profile of women ask treatment. The profile is a Cypriot, 40 to 70 years old women, very well educated, with a very good job, good financial income, and the majority of these women have depression and anxiety. And the majority of these women have experienced premature abandonment of treatment. This program focus on different kind of women, of the vulnerable women that will never maybe ask for help. These women, we find these women in the social support services. And the program we launched together with the National Betting Authority and with the Domestic Violence Association, SPAVO, focus on this group, on women that are in contact with the Domestic Violence Association, SPAVO. They ask for help for domestic violence, but people there, the staff, can screen and find other issues and other related to gambling harm that these women may be affected by. So the procedure includes a protocol which describes the screening of these women, the referral of these women to the treatment services, the follow-up, and something very important is that even if they don't experience gambling-related issues, they may experience in the future, because we know that there is a very, very, very high number of women which have trauma or other problems or have been abused. They experience in the future sometime gambling-related issues. So we started this program by educating the professionals at SPAVO and also the professionals at the treatment services in order to be able to take care of these women when they are referred. At the moment, we just started this program. It's new for us, and the goal is to expand this program to other social services, to other support networks. And I got the experience from Diana. She said before that they trained so many professionals, and maybe we can expand the program to GPs, to primary healthcare, to mental health services, to social services, and to any kind of support services we have in Cyprus. Train the professionals so they feel more confident to find and screen if there are any related to gambling harm, and support these women to ask for help.
This is a critical question, the integration with general health services, because it will also sustain, as my friend Laura says, treatment there. And in line with what my friend Marina says, we need to identify the appropriate KPIs so that we know that we learn from this experience in this program and support it to grow. We've only got 5 minutes, so Chair, I don't know if we have any questions. I don't have a tablet here, so if there are any questions, happy to address them. Happy also to take questions live. If there's anyone who's interested. No questions. So if there are no other burning questions, I think we can conclude. Oh, yes, please.
I would just like to ask, when you say that women find it hard to get help or find it hard to know that there's help, is that a study of women only, or is that compared to what men say in a similar study?
There was a study of women only. Gambleware did a study called Building Knowledge of Women's Life Experiences of Gambling and Gambling Harms. And the report was delivered April of this year. So it was a study that was concluded by Gambleware.
It probably, though, means that we need to sort of be flexible with our outreach approach as well. So whatever we are preparing in terms of responsible gaming, we should probably find the right way to make it relevant to women as well. It can't be just men playing games, or it has to be relevant to women as well. We see in the spots, the various advertisements, it has to be close, it has to hit home for them as well.
Definitely, and I think that also advertising for women in terms of gambling is very much proposed. It's in the UK more so, like of being sort of bingo, so join a community, build a friendship, build a community group. So a lot of the women, they may start off with that type of gaming and then move over to other types of gaming. And also I think that often is the case that, you know, for women, even thinking about, you know, another reason why they don't access support is a lot of the time around the fear around accessing support. So, you know, if they've got children, would they risk losing their children? Are they in a job that may, if it's highlighted that they've got gambling issues, may affect, you know, their earning potential and you know, their social situations. So there are many different ways in which for women it can be detrimental, not for just for themselves, but for their families and also the wider community.
Completely true. So, Chair?
If you want to discuss 2 more minutes, you can do so, of course, even 3.
Can I just invite a closing comment from both of the speakers, please?
Yes, of course. Okay, I will start. We hope and we aim to make the treatment available for everybody and make stigma less being a barrier for women. And I think this is not just one's responsibility, but it is the society's responsibility. It should start from the society to let women be, to inform women first about what is accessible, what there is in the society, how they can ask for help, give them more options of help, more support. And I think this is the first step. And then we need to go to the primary care, the health care, and engage the GPs, engage the mental health services, engage all the create a big network and to support and help women ask for help. And as it's concerned about advertising, we believe that also the gambling industry should take in their mind about the women special needs, and be more sensitive with their needs and refer any kind of harm-related behavior to treatment services. This is very important. And here I would like to say about the helplines we have. We have 2 helplines in Cyprus. So if even we make these helplines obvious to everybody, it's one step so they can ask for help anonymously without stigma.
Of course. Diana?
Now, I'd like to say that I think for women, it's really important that we sort of raise awareness, and that would be direct to clients and also with professionals that are working with women in any capacity. And so the first thing is raising the awareness. And I think that starts from childhood, you know. It starts with us working with children in schools, talking to them about gambling and gaming, and then moving on from sort of like the early stages, then moving when we have got women that have issues, is really about providing that support and making sure that it's accessible. Because I know that a lot of people in remote areas, they may find it difficult to travel to centres, so making it accessible in all different platforms. And also really sort of feeding into research is really important. All of the work that we do, if we're not measuring, then we can't assess whether it's working or it's not. So it's really important that we feed into the research so that we can continue to build programs that support women today and for forever.
Yeah, this is very important. And we need to find the indicators so you can evaluate every kind of program and to evaluate the program and to know if it's successful so we can change it or do it the same way in the future. This is very important, I agree.
So thank you all for your patience. Thank you to our lovely speakers. Really enjoyed the conversation. So after you.
Thank you, Christina. Respect for what you're doing, and thanks for your excellent presentation.